Yeah, you're right.
All right, got it.
Okay.
All right. Hey, good evening, everyone. I'm so glad that you're here. Greetings from the League of Women Voters of Metro St. Louis. I am Angie Dunlap, president of the St. Louis League. The League of Women Voters has been around for more than a century, working to educate and empower voters, and we defend democracy. Missouri voters decided to expand healthcare with the 2020 ballot issue, and Missouri elected officials should listen to those voters and make democracy work. The League of Women Voters is a nonprofit organization powered by our volunteers, and the League is nonpartisan, but we do take position on issues that we have studied, like Medicaid expansion. And the League has healthcare goals that include a basic level of quality care at affordable cost. And healthcare should be available to all U.S. residents, and healthcare needs to be equitably distributed. Thank you all for coming tonight to learn from this healthcare panel, to learn about helping Missourians get connected to expanded access to Medicaid. Our co-sponsor tonight is the St. Louis Metropolitan Alumni Chapter of Delta Sigma Theta Sorority. Janice Baker is here tonight from that organization. Denise, will you now introduce yourself, your organization, and tonight's moderator?
Thank you, Ms. Dunlap. Good evening. I am Janice Baker, president of the St. Louis Metropolitan Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Sisterhood, scholarship, service, and social action is at the core of what we do. Thus, healthcare for all is at the center of this conversation. We are proud to co-sponsor tonight's event with the League of Women Voters St. Louis. Tonight, our discussion is centered around what's next for Medicaid expansion in Missouri and the progress that has already been made. We have an amazing moderator and distinguished panel tonight. As a reminder, don't forget to put your questions in the chat or in the comment section on Facebook. Next, we will have greetings from Risa Black, Social Action Chair.
Good evening and welcome. Thank you so much for attending this very important and informative panel discussion on Medicaid expansion. We are so happy that you could join us this evening. Thank you.
Thank you, Risa. I have the honor to introduce our moderator for tonight, and she will introduce our distinguished panel. Tonight, we have Louise Wilkerson, who is the VP of the State of the Board and immediate past co-president of the League of Women Voters, St. Louis Metropolitan Chapter. I will have to take a moment of privilege to say she is also a past president of the St. Louis Metropolitan Alumni Chapter of Delta Sigma Theta Sorority. Please welcome my mentor, Ms. Wilkerson.
Oh, you're too kind. Thank you so much, Sarah Baker. Good evening. It is my pleasure to serve as your moderator this evening and to introduce the members of our distinguished panel. In alphabetical order, we have State Representative Ladonna Applebaum, and she represents House District 71 in the Missouri House. She's the ranking minority member of the Health and Mental Health Policy Committee, a very important committee. So we're just pleased to have her with us. Number two, Amy Blewen. She's the president and CEO of the Missouri Budget Project. Now, the Missouri Budget Project is a nonprofit organization committed to improving the quality of life of Missourians by informing public policy decisions through objective research and analysis of the state budget, tax policies, and economic issues. Welcome, Amy. Then we have Donna Checkett, who is a member of the League of Women Voters in Columbia, Missouri. But currently, she is also a member of the Missouri Foundation for Health Board of Directors, and she is a past director of the Missouri Medicaid program. So she comes with a lot of knowledge about the Medicaid program. thank you, Donna, for being
Thank
with
you.
us. And then last, but certainly not least, we are just pleased to have State Senator Brian Williams with us. He's representing Senate District 14. He's an assistant minority floor leader. He had achieved that status in a relatively short period of time of being in the Missouri Senate. I was really amazed. But anyway, he's a member of 11 Senate committees, including the Senate Appropriations Committee. Thank you so much, Senator Williams, and welcome. Now,
Ms. Wilkerson, you also forgot to say a proud member of the Kappa Alpha Psi Fraternity Incorporated.
okay, I do apologize. I don't know how I could forget. Yes.
And
Now,
also a proud member of the St. Louis Alumni Chapter as well here.
okay, so Kappa Alpha Psi is similar to Delta Sigma Theta in terms of being nonprofit and focusing on social issues, right? And like voter registration and so forth. Okay, so we are very pleased to have you. Now, let me talk a little bit about this evening. This evening, we will present a collegial discussion of the very important issues related to the long-awaited expansion of Medicaid in Missouri. We know that Medicaid is being expanded in Missouri solely due to the hard work and insistence of voters who initiated a citizen petition to get the matter on the August 2020 ballot. Fortunately, a majority of voters said yes to Medicaid expansion. Yet, we still have concerns because there have been attempts by the responsible state agencies and some legislators to resist implementation of the expansion. And so that's why we're here this evening. We know that you may have questions, and many citizens need reliable information about the Medicaid program in Missouri. Our panelists are here to answer your questions, help us understand the current status of expansion implementation, what obstacles may pop up, and what we as citizens can do to ensure successful expansion implementation. I also would like to mention Margaret Gray, who you don't see, she's on here somewhere, but anyway, she's a member of the League of Women Voters. She serves on the Healthcare Committee under the chair, Irma Rubling, and Margaret is largely responsible for this panel discussion this evening. So I just want to tip my hat to Margaret. Now, a number of questions have already been submitted, and I will ask those questions. Audience members may submit additional questions in the chat. I will direct some questions to all panelists and others to a particular panelist. However, any panelist may respond to a question that has been asked of another panelist. We intend to conclude the program by 8:30 p.m. Each panelist will be allotted 2 minutes to share information about themselves and their interest in Medicaid expansion. They will also be allotted approximately 90 seconds to respond to questions and 2 minutes for concluding remarks at the end of the program this evening. During the wrap-up portion of the program, important information will be shared with you, the audience, on screen. Be prepared to jot it down or photograph it using your mobile device. At this time, I am pleased to introduce our timekeeper, Barbara Harris. Raise your hand, Barbara. Okay. She will hold up a little paddle to alert panelists when they have 30 seconds left to finish what they are saying. Panelists, do you have any questions? Okay. If not, let us proceed. I I'd like Representative Ladonna Applebaum to tell us a little bit about herself and her interest in Medicaid expansion.
Well, good evening, everyone. It's so nice to be a part of this panel this evening. I am a little bit, maybe a little bit different coming into this evening about why it's so important to me. You'll bear with me a little bit, but this month on October 1st was actually the anniversary of my first surgery to get rid of the girls that were trying to kill me. It's how I put it. So Breast Cancer Awareness Month 7 years ago, I started off with a bang. And during my process of treatment, I met a gentleman during chemotherapy, and we got to know each other a little bit. And I found out that he was not going to be able to continue his chemotherapy. And I was like, why? And he said, because he couldn't afford it. He was one of the people that fell into the gap. So he wasn't poor enough to qualify for Medicaid, and he wasn't wealthy enough to have insurance. And that really made me mad, made me feel guilty, because the insurance that I had at the time was through the ACA. And I knew that the ACA was trying to help with Medicaid expansion. So I got angry, and I went to Jeff City, and I started knocking on the doors of the senators' offices and representatives' offices and asking them, please expand Medicaid. And I was basically kind of laughed at. So it felt really good on October 1st of this year to say it's implemented. And now we just got to make sure that everyone knows about it and knows how to sign up for it to do the right thing. So anyway, thank you for hearing the story, and I look forward to more discussions throughout the night.
Okay, thank you very much for sharing that. Next, I'd like Ms. Amy Blewen to tell us a little bit about herself and her interest in this issue.
Thank you so much, and thanks for having me with you tonight. I am always moved when I hear those stories, Representative Applebaum, so I really appreciate that, because it brings it home, right? It brings what we're doing and what we've been advocating for home in a really real and personal way, which is very important. So at Missouri Budget Project, we have been working on this issue for years with many of you and advocating for it. We advocated for Medicaid expansion at the ballot. We worked to support efforts to ensure that the Supreme Court ruled that Medicaid expansion would need to be implemented. And now we are preparing for what could be a difficult state legislative session. Now, legislators are going to need to provide the funding to support the implementation of expansion. That has not happened yet. And we know that there was a very contentious debate last year, and we're going to need kind of all hands on deck this year to make sure that we get that funded in the supplemental budget in January. So we need all of you, and I'm going to hopefully have a chance to talk more about that. But what we need is we need to really start taking this debate back. We know that 250 to 270,000 people in Missouri are going to receive health care because of Medicaid expansion, which is the most important aspect of this. But we also know that there are budget wins for the state. We know that there will be a significant amount of federal funds coming to Missouri to support the health and mental health of our citizens. And we know that that's going to have an economic benefit for the state as well. So all of those messages need to reach our lawmakers, and the folks that are here tonight know that. Thank you. I'll stop.
Thank you very much for sharing that. It's great information to have. Okay, Ms. Donna Checkett, let's hear about you and your interest in the issue.
Well, everything I had planned to say, of course, I'm immediately changing my mind because I'm so inspired by the previous speakers. So I'll actually share that I got involved with healthcare when I was a little bitty baby, and I spent the first 4 years of my life living in a little apartment on top of Grace Hill House, and that is now one of the biggest federally qualified health centers in the country. In the state. My dad was a social worker there, and we moved from there. And I've spent my whole career in life really. I look back at that and working on behalf of Missourians and at many times on behalf of people across the country on Medicaid access. I did serve as state Medicaid director for 8 wonderful, challenging, hard years. We made a lot of accomplishments. We did expansions. We started the federal reimbursement allowance. We started Medicaid managed care. And I'm really happy to be able to bring that expertise as well as that I've gained through other roles since then in my career to helping people understand, how the Missouri legislative process works, how CMS works, what's the requirements from the federal government, how does the federal matching rate work, how are we going to get news out to people about this expansion. And so I'm just very happy to be here tonight to be able to share my expertise and my heart and my commitment to this program and this population. So thank you for having me.
Okay, you're welcome. Senator Williams, you're next.
Good evening. First, I want to again thank the League of Women Voters and Delta Sigma Theta Sorority Incorporated for hosting this discussion on Medicaid expansion. As we were thinking through this process, I really understood the importance of taking important issues like Medicaid expansion and keeping them front and center and really work towards true implementation in our state. I want to thank my fellow panelists for their insights and continued work to help get people healthcare they need. There's a lot of questions about the ongoing enrollment process, the type of outreach that'll be needed. How can we make sure that Missourians receive their constitutional right to Medicaid? So I look forward to not only hearing from advocates and organizations about these issues, but my primary focus will remain as a member of the Senate Appropriations Committee, continuing and protecting funding for Medicaid in the upcoming legislative session. One would think, or at least hope, that the funding fight ended with the court order, right? I'm sorry to say it did not. There were some lawmakers that tried to sabotage Medicaid expansion through the budget process again, and they'll try it with the supplemental budget next year. They'll try it with the fiscal year 23 budget, and they will try it any way that they can. So it's so important that we take this conversation and remain vigilant and steadfast, just as we have been every step of the way. And the only reason we are focused on this is not only is it important to ensure that Missourians have access to healthcare, but the voters have spoken. The courts have spoken. Medicaid expansion is the law of the land, it's the Constitution. And we always have to stand together to make sure that working people get the healthcare that they need. So again, thank you so much for this opportunity to participate this evening. And I'm looking forward to a discussion on what I would consider one of the most historic policy changes Missouri has seen in years.
Okay. Well, thank you very much. And I guess I'm going to go off script a little bit and just ask a question that goes to one of the underlying issues with respect to Medicaid expansion and indeed any social service program in Missouri. And what I'm going to talk a little bit about is this myth in Missouri that I won't say any, but social service programs will benefit the urban settings the most. There's a myth out there that urban populations and predominantly minority populations will benefit, and that rural Missouri, residents of rural Missouri won't. And I think that's one of the reasons why there's been so much resistance. Would any panelists like to speak to this rural versus urban divide in Missouri?
I'm happy to speak to them. I agree. I think there is a significant kind of barrier in awareness and understanding, about this, and that it really, if you look at the facts, there's a larger portion of the population in rural Missouri that will benefit in their local communities from Medicaid expansion as compared to urban areas. If you look at just numbers, the numbers of people are obviously skewed to urban areas because that's where the population centers are. But definitely the percent of the population that will benefit is larger in many of Missouri's rural areas, particularly the Boot Heel, in other areas of the state, farmers who don't have access to healthcare insurance, whose incomes may not be very strong each year, and others who just don't have access to affordable insurance.
Okay, thank you. Anyone else like to weigh in on that? Okay, let's move on then. One of the first questions has to do with the target population. We've been told that approximately 275,000 eligible low-income Missourians may be able to benefit from this expansion. What office or state agency has information that identifies those 275,000 Missourians who will probably qualify for Medicaid under the expansion? Let's see. I don't know, Ms. Checkett, do you have any idea?
Well, unfortunately, I don't think there's a single registry of those individuals. That number was developed really looking at broad demographics of the state, economic information about earnings, number of people in various households that would qualify. That said, many other states that have implemented expansion have looked at databases with people who would likely be eligible. This would include people who have applied for Medicaid in the past. They may have applied for SNAP, which is food stamps, or other social benefit programs. Departments of Education can look at people who are on school lunch programs. There's some great sources of information of people who would be likely. And again, in some states, those states have actually reached out to those populations, as well as to communities and various entities serving those populations, to let them know that they were eligible. Some states have even actually automatically enrolled people, and they've been able to tell that they would be eligible. And there's also all the individuals who are coming out of incarceration who will be eligible for Medicaid the day they leave the prisons. And many states have looked at those populations and done outreach to those groups as well. So those are all things that Missouri could do.
Could do, okay. Okay. So that's a concern in that it's something the state could do, but we're not sure it'll be done. But anyway, here's another question. How does Medicaid expansion impact people with disabilities who are already covered by traditional Medicaid programs? Any ideas on that? No? Okay.
It depends. I would say it depends. So,
okay.
So a couple of things will happen. That folks, there are people with disabilities who are already covered. There are people in Missouri who will develop disabilities over their lifespan who aren't covered by Medicaid yet. Medicaid expansion will allow those folks entry into coverage more quickly and easily based on income rather than going through an arduous process with determining disability coverage, which requires, proof of disability, and it can take quite a significant amount of time to receive that eligibility. So, folks just based on income are going to be able to access coverage much more simply, and it's going to be less expensive for the state that way too, to cover folks, because we will be drawing in more federal funds. So it makes sense, both from, an easy application perspective, but also from a fiscal perspective.
Okay, we'll delve into that.
And one more thing I'd like to add is my first year in the Senate, I passed legislation addressing what we have as MOABLE accounts. And that's something to keep in mind. We removed the conservatorship, but essentially what that MOABLE account would do for disabled Missourians is allow them to be able to essentially have a 529 savings account to keep them from exceeding that income threshold as well when it comes to access to benefits in the state of Missouri as well. So that was one just element to that question in terms of disabled folks who may receive a lump sum of money or maybe inherit something. It doesn't count towards income that could potentially cost them their benefits under Medicaid.
Okay. Yes, Ms. Checkett.
If I could add, Senator, thank you for that information. I'm familiar with that program. I think it's an excellent idea. To add to Amy's comments, it's also important for everyone to understand that it is the same benefit package. So for people who have disabilities even now, and perhaps they haven't qualified because the disability wasn't significant enough to get onto Medicaid, please don't let that be a worry or a reason not to apply. Apply, get eligible. If there's a reason to move to a different type of category of assistance, we can figure that down the road, but everybody's going to get the same benefits. So there's no reason not to apply for Medicaid expansion for adults. It, I think, will be probably the easiest way to get covered at this point. Certainly not going through that whole medical determination process, which, as Amy said, can really be lengthy and requires doctors and, information and all kinds of stuff. So it's a really good question as well.
Okay, thank you. We know, at least I was aware of the fact that Missouri had one of the most strict set of requirements to qualify for Medicaid. In other words, it was very difficult to qualify for Medicaid. And so, frankly, many of the working poor weren't able to qualify for Medicaid, and they didn't make enough money to purchase insurance on through the ACA, so they were just left out. So can anybody speak to what the fundamental income requirements will be with this expansion and so forth? So how will eligibility requirements be, I guess, a little less stringent? Anybody? Oh, Ms. Applebaum.
I have some stats right here in front of me that I can just read you guys if you want me to do
Great.
that. Okay. So a household size of one, it's $1,400. They need to be at or below that amount. The household with two people, it's $2,003. For a family of three, it's $2,525. For a family of four, it's $3,048. Family of five, $3,570. And for a household of six, it's $4,092. So
are those numbers per month or what?
monthly household income need, yes.
Okay, so that's monthly income. All right, so now for a family of four, what is it?
$3,048.
Okay. And a single person, what is it? One individual?
One person is 1,481.
Okay, so that's the current eligibility requirement, right?
New.
Huh?
New.
New, okay, all right. So, well, that helps us kind of understand it a little bit better. Okay, here's another question sort of about eligibility. Will disabled persons under 65 that may be enrolled in Medicare, that may be enrolled in Medicare be eligible for Medicaid to help with Medicare premiums, copays, and deductibles?
Can I respond to one of the
Yes.
questions that's in the chat, just to clarify or to build on what Representative Applebaum said? Just to give context, prior to Medicaid expansion, the amount for a family of 3, the monthly income limit for a family of 3 to qualify for Medicaid expansion or Medicaid was $393 a month. So if the mom made more than $393 a month in a family of 3, she did not qualify for Medicaid.
Oh.
So that gives you a sense of how significant that change is. And similarly for seniors who are, folks under or nearing retirement, I should say, people between 55 and 65 nearing retirement who may have significant health issues, who may have less work available to them. If they are income eligible for expansion, they would qualify just like other adults who are under 65.
Okay, boy, that's a significant improvement. I can't believe that. The prior, no wonder people couldn't qualify. My goodness. Okay.
Louise?
Yes.
Could I add
Donna.
to, one of the other challenges in Missouri was that, and there are many different categories of assistance or different ways in which people are eligible, but many of those required also verification of assets. So in addition to bringing payroll stubs in, you would have to show how much you have in the bank or what is your house worth. So many of our low-income families didn't have any assets like this, but a lot of paperwork was required. And then sometimes people had just enough that even though their income was very low, they were kicked off the program. I think one really important thing for people to realize is that for this expansion coverage, we don't have that asset verification process. It's really just based on your income. So again, people who were turned away in the past are going to be eligible now. So really important for people to understand that.
Oh, that's a biggie. That's a biggie because I remember being responsible for an aunt some years ago, and we needed to access Medicaid to help pay for her nursing home expenses. And I remember we had to go through some hoops there. She couldn't have over a certain amount in terms of assets. So it was rough. So that's good to know. Thank you for that clarification. So what sort of legislation do you expect that we will see in this upcoming session that may be designed to limit Medicaid expansion in the 2022 General Assembly session? Senator Williams, do you have any thoughts along those lines?
Yeah, absolutely. I don't know if it'll necessarily be, there'll be legislation. It's an election year that would pander around Medicaid expansion, healthcare as a whole, all kinds of things, clearly attacks on reproductive health rights, list goes on. But I think the real fight is going to come, and where the fight has been from the beginning is the state not wanting to uphold its commitment to the Constitution and fully fund Medicaid expansion. And what we saw was that there were folks who did not support fully funding Medicaid expansion, even after the governor made a recommendation to fully fund it. The legislature decided to go a completely different direction. So what I think the biggest concern and what I see happening is most likely the legislature still refusing after the courts, after the voters have demanded and have shown up to fund Medicaid expansion, still refusing to do so. And I want to be clear with everyone that's listening on here. And I made this very clear to colleagues of mine who were not in support of upholding their constitutional right. Their constitutional oath, and that is to uphold the will of the people. And that is our job as elected officials, is to uphold the Constitution and our oath to the state of Missouri. And that did not happen with members deciding not to fund Medicaid expansion.
Okay. Well, thank you. And toward then we'll get to what is it that we as citizens can do about that. We'll look forward to your recommendations. We know that the governor kind of shook up his cabinet last week. And we know that, let's see, the previous director of Medicaid returned after, let's see, Todd Richardson from Poplar Bluff, former legislator. Well, he's back to head up Medicaid expansion. So are there any concerns that this cabinet shakeup and the absence of Mr. Richardson, I think he was gone for some months, do you think that will have a negative impact on implementation of the expansion?
I don't know if it's safe to say that. What I do think is, and keep in mind, I've spoken publicly and have talked to many folks about the shakeup within the governor's administration and Health and Senior Services. Missouri Health Net was not the only agency and department that had some things move around. We just recently had a change with the Missouri's foster care system and children's division, which there was a move around in that department with the state level. And, what I've told the governor directly, even the Department of Social Services, that I hope his intentions is to put people there that are serious about protecting some of our most vulnerable population in the state that depend on Medicaid or even our children that we've seen that was kicked off the roll a year ago. And I'm going to give him an opportunity to see if he's putting people there that are going to uphold the interests of the department, and that's putting Missourians first. So I wouldn't jump to that conclusion quite yet, but I do think it is a concern, and I do think, based on what we've seen this past session around Medicaid expansion, is definitely worth paying attention to.
Okay, so we'll have to remain vigilant. Yes, Donna, Ladonna.
Ladonna.
You can call me LA Donna. It's whatever you like. But I'd like to echo on what Senator Williams is saying. I'm a little nervous, but because I am the ranking member on the Health and Mental Health Committee, I've gotten to know our new director for the Department of Health and Senior Services, Director Kawaroff. And it's with joy in my heart that I can say that he believes in Medicaid expansion. He believes in wearing masks, and he also believes in vaccinations.
Yay.
That's going to change anything with the Missouri Medicaid expansion, but I just feel like we have someone that's probably more of an independent than would be someone farther on the other side of the aisle in charge of that department now. So I just wanted to share that with you guys.
There should be also one more point that's made for the listeners This is a very unique situation because I don't want folks to assume, at least in the Senate, I don't know what the numbers were in the House, but in the Senate, we had bipartisan support in expanding Medicaid and funding it. So there were members from both parties that felt it was important to uphold their oath to the Constitution and fully fund Medicaid. And so, you know, we do want to make sure that's something that's made clear. It wasn't an issue that was along party lines. So what that tells me is that there are outside forces and outside influences that are determining how some members of the body has sided with this issue. And clearly, it was not about the interests of Missourians or even really about ensuring that folks have access to quality health care. And I want to also point one more thing in the rural versus urban conversation. Southeast Missouri is one of the most poverty-stricken regions in the country, far poorer than St. Louis. And to think that they do have some members of the General Assembly who have not saw the value in ensuring that some of the poorest people in our state don't have access to health care or even really any type of services. It should be really a gut check to folks who thought it was important to support them in any capacity.
Thank you. That's very important. Now that is amazing. Folks, legislators representing that region, I don't know. I don't understand it. Now,
I'm
yes,
sorry,
Amy.
Amy. Just to add to what the senator said, I think that, or just to add to what he said, I think that the same dynamics that occurred last year are what we still expect potentially this year. You know, the governor proposed the funding be included. The Senate was ready to go along with it, and that just a few people in the House really presented a barrier for it. And, you know, I think that that's what we expect again this year, and why it's going to be so important for everybody to be involved in the debate.
Okay, thank you. Let's look at that funding issue. I can recall Governor Nixon going around the state after the Affordable Care Act was passed, and he was making a plea for Medicaid expansion. And I attended one of those sessions that he had here in St. Louis, and he was talking about all of the federal dollars that would come to Missouri if we expanded, and how that would benefit the economy and benefit the people. And to me, it was a win-win situation. So can one or more of you explain what type of federal support would Missouri get, and how much would be required in terms of state money to go ahead and expand Medicaid? Anybody? Amy?
Yeah, I think Amy would be a good person because this is kind of her wheelhouse, and I don't want to put her on the spot. But I will say this, as of today, the state of Missouri has a record surplus. So if anyone was to say that the state of Missouri does not have the resources to fund the Medicaid program, that is false.
Wow.
And I'll pass it on to Amy.
Okay.
That is true. That is true. I think we have something like $2 billion in the bank in Missouri, which is unheard of. So Medicaid expansion, you know, 37 other states have expanded Medicaid before Missouri. So we actually have really good data on what happens when those states expand. And you have in every state savings to the state budget and increased state tax revenue that more than pay for the state portion of expanding Medicaid. So the way that works is, you know, currently Medicaid coverage is about 65% federal dollars and about 35% state dollars. Medicaid expansion is 90% federal and 10% state. The savings exist because people move from one category to a different, to the expansion category of coverage, which has that higher federal match. So one really easy example is folks with mental health needs. Missouri has programs currently that are funded entirely with state dollars to cover mental health care for some folks. Those folks will become Medicaid eligible and will leverage 90% of their care under federal funds rather than the entirely state, funded program. In addition, the American Rescue Plan Act, which was passed by Congress just several months ago, included an incentive for the holdout states to pass Medicaid expansion. That incentive will give Missouri another $1 billion over a 2-year period. So in addition to leveraging federal funds, we'll have $1 billion in funding that can be used to offset general revenue in the state to support other services too. The big impact is not only can people access care, our budget and costs will be reduced, but our economy will be supported by that significant influx of federal funds coming to the state that we otherwise wouldn't get, that then supports not just jobs in the health and mental health industry, but ancillary industries as well. So we'll have a significant economic churn from this, which will also help the state. So there are all sorts of benefits.
Okay, Donna.
Well, I would just like to point one particular benefit out that is really important, and that is our struggling rural hospitals, which have been closing at an alarming rate or shutting down and going to urgent care like facilities only. In many parts of our state, this is the source for healthcare, other than winding roads finally up to a larger metropolitan area. So these hospitals, there are so many people in rural Missouri who are going to benefit from this expansion that's going to keep those hospital doors open. It's going to be paying for health professionals to live and work in those communities. It's a very important benefit that we need to remember when we're talking to legislators about the value of Medicaid expansion.
That's very important. I was going to ask about that, but the benefits to rural Missouri, thank you for explaining that. I was reading an article in the Post-Dispatch last Thursday about a rural Missouri clinic in Mountain View, Missouri, closing. And in the final visits with patients, the director is advising them to enroll for Medicaid. And a lot of them don't know how. It's a daunting process. And the article said that now, more than a year after the ballot measure expanding the program passed by a statewide vote, and more than 3 months after the courts ordered it implemented, the work connecting the uninsured to Medicaid falls to frontline staff like this director at the Good Samaritan Clinic. I won't go into all the details, but this is rural Missouri. And this clinic was started by a doctor and some residents because they had virtually no access to healthcare. Very small clinic. But the concern is, do you anticipate that the responsible state agencies will reach out to citizens in Missouri to let them know about the Medicaid expansion and to let them know that perhaps they should apply again if they applied in the past and didn't meet the eligibility requirements? What can we expect in terms of outreach in that regard? Anyone? Ladonna, what do you think? unmute.
I always forget those things. I've got to unmute. So I think just the way that we rallied, so many people rallied to get Medicaid expanded to begin with, we have to rally again. We need to make sure that the state agencies are spreading the word, just like the state legislators. We need to be spreading the word, and we need to make it part of all of our social media. I know it's just as simple as a website where people can start their application process. It's my DSS. I'll put it in the chat here in a second, but it's mydss.mo.gov. Healthcare apply. It's very simple. But there may be people that don't have access to, a laptop or a computer, and they may need to do this at a library. There's just so many different ways that we can rally again. Like Senator Williams said earlier, that, once that court battle is over, it's kind of just like died down. People haven't been talking about this much. We need to talk about it. We need to talk about it a lot.
Okay. Donna?
Yeah, I'd like to jump in here. In drawing on my years of experience at the state, albeit it's been a while, the State Department's historically not really promoted programs like food stamps, like low-income energy assistance, like any of these things. You can wish they would or wish they wouldn't, but I'm just to frame it for everyone, they historically haven't done that. So I think, and they're certainly not doing that now. So I think the most important thing is for us to recognize they are going to do what they need to do, which is process applications. And we can talk about that in a little bit. I think they're really doing that. We've got some great stuff going on in the chat here with some resources about income eligibility, and Nancy Kelly is from the foundation has put something in, and I know that Representative Applebaum is going to be doing something as well. So I urge you all to click on that. I think my thanks to Louise and Barbara and everybody, these types of forums are what we have to do. And it's a comment upon all of us to spread the news. There is a big network of people through, Cover Missouri and lots of other groups who are working to get the word out. The Missouri Foundation for Health, the staff, I can't take any credit for it. The staff have done a fabulous job putting materials together that are available on the website. So this is a time for us to step up. We want expansion. Great, let's make it happen. But just to be honest, I just don't think it's realistic to think the state is going to do it. They haven't ever. So, and I want to frame that too, because I think that's important to recognize. My thoughts.
Okay, anyone else? I think that's very important. So in other words, we shouldn't hold our breath waiting on the state to promote Medicaid to those people who desperately need it. So it's going to be up to folks like us and organizations like the League of Women Voters, Missouri Foundation for Health, Delta Sigma Theta, Kappa Alpha Psi. It's going to be up to us to get out there in the community and spread the word.
I'm sorry, literally print out some of these materials and ask people to put them on their bulletin boards.
Okay.
I think we need to really look at a grassroots advocacy strategy here. And to think the state is going to do it, I think is unrealistic. I apologize for interrupting you, Louise.
No, that's okay.
Broke the rules. I'll contain myself.
No, you didn't break the rules. This is kind of easygoing and free flowing, and that's how we like it, right?
Absolutely.
I think that's more productive. Senator
Absolutely.
Williams, you got something?
Yeah, and I think it's so important that what we take from this and the goal of this was to keep these issues front and center. And what happens is, things happen. I know a lot of information and a lot of situations in the world are coming at us, but we don't want the state, we don't want folks in our community to wait until something bad happens and they need these services to realize that they are not available. So we want folks to be aware of that. We want folks to be able to inform and educate their neighbors. And that's the primary reason for this. It wasn't to see who knows the most about Medicaid expansion. It was about raising the awareness and ensuring that everyone utilizes their resources to ensure that loved ones, friends, people in the community and throughout the state are covered.
Okay, great. Now,
Can I add?
yes, Ladonna.
And I just want to make sure everyone's aware that the Medicaid expansion covers preventative care. I'm not sure if that was mentioned just yet, but that's huge.
Yeah,
I mean, that's part of the ACA and it's so important, and that will also, just having preventative care save so much money. So anyway, just wanted to throw that in.
well, here's the thing. It will save lives. What we're talking about here is life and death stuff. And I don't know, it doesn't get more important than that. That's all I can say. So now, I've heard that the application process can be daunting. Can those applying for Medicaid under the expansion get help getting applications and getting through the process? And how do they find help? Can anybody help? Because what I'm thinking about is some people may not have access to the internet or computers, and maybe they can go to a library or whatever. But even if they do, is there any help available in filling out the application forms?
Yes, and Nancy Kelly, I'm gonna I'm gonna ask Nancy to stick the phone number into chat for Cover Missouri, and they have a hotline basically that anybody around the state can call and then get help with their what they need.
Okay,
And
so
apply.
that's covermissouri.org/help. Okay. Oh, and the call center is 1-800-466-3213. Very important. So I want to make a note of that number so that we can share it and spread it. Anyone else?
I think
Okay.
it's important also to know that many of the hospitals, especially the hospitals that see a lot of Medicaid or lower income families, our federally qualified health centers have staff at those provider locations who are able to help people with application processes. So they're right there if you're in the middle of a medical encounter. Also, legal services has staff. There's a group of young law students at St. Louis University who have gone through a training program, and they're available to help. Again, grassroots, we have to do this together. The state's not going to do it. We have to do it. And there are a lot of resources out there.
Okay, so we'll be working on getting that information out where people can get help. So we'll try to give that kind of information at the end of today's program. Now, will there be a deadline or limit on enrollment in Medicaid, as a result of the expansion? So in other words, will we look up at and find we're getting an announcement that January 15th is the deadline, and if you didn't enroll by then, it's over? Anybody? For the year?
No, there's no limit. People can go any day, anytime.
So it's ongoing. That's great. Well, I was just thinking about what is it, Medicare enrollment and all of that. And I know the period has started now, and it ends sometime in December or something like that. Okay, that's very helpful. There's a concern about whether or not healthcare providers will feel that they can afford to include Medicaid patients in their practices. I remember some years ago, there was concern among doctors and providers that the reimbursement rate was too low, not only for Medicaid, but also for Medicare. So do you think there will be concerns like that in the healthcare community? Anybody? Yeah, we'll just have to wait and see.
I have my on that. So my healthcare experience, I've been on all sides of it. I used to provide custom knee bracing and back bracing and contracture bracing to people that needed it. And this was back in 2001 to 2009 when I did this. And the Medicaid, whenever we would get Medicaid patients, we would have to fill out paperwork by hand, and it took a long time to get reimbursed. And I think that was an issue that was going on in the past. I would hope with today's technology and high-speed internet and all that we have, that process will speed up. That's my hope. And people will get reimbursed in a timely fashion. I don't know that that's going to happen, but that is my hope.
Okay, thank you. Well, that's something we'll have to take a look at and watch, because we've heard, and some of this came to light as a result of this recent discovery that the Department of Elementary and Secondary Education's databases were vulnerable to hacking and accessing Social Security numbers of retired teachers and whatnot. So as a result of that, it came up again in the news that Missouri's Missouri's technology in terms of handling data and systems for processing stuff that is very outdated, and that we haven't had enough investment in upgrading that equipment and the systems. And I'm really concerned about that. So, because I do recall, as you know, during the pandemic, when we had a rapid increase of unemployment applications for unemployment benefits, that turned out to be a hot mess because the system wasn't equipped. So maybe that's something we'll have to take a look at, and maybe some of this money that the state has can be spent on upgrading those systems. Yeah, Senator Williams.
Yeah, that's a really good point that you made. So I'm chairing a newly created committee called the Technology Caucus.
Oh.
And what we've been talking about right now is actually figuring out how do we help the state of Missouri streamline a lot of its systems, its data. I think if you're not upgrading those systems and expanding them in ways to provide information, it only contributes to what folks believe is a net bureaucracy. So I'm hoping we're going to take this conversation, and this will be some information. My office is, my staff's on, so they'll take notes and we'll look at that. Another thing is looking at central repositories for expungements. It's so many things that we can do to really help the state accommodate folks and be up to speed in the current century as well.
Okay, Amy.
Yeah, so one of the things that we've been looking at too is exactly what you're talking about with the technology problems throughout the state. And we have significant opportunities coming in the next year to make improvements. One of those opportunities is the fiscal relief funding coming through the American Rescue Plan. to the state of Missouri. You know, that provides a resource for us to tap into, that we can fund some of these unmet, you know, needs in the state that haven't been dealt with in, you know, decades. So one of those needs is definitely technology. There are other priorities that I'd love to share with you, and maybe you can help us spread the word on those.
Okay, great. So once again, well, this question may be redundant, but I'll ask it anyway. And the question is, will Medicaid expansion be adequately financed? Well, I guess we don't know yet. But anyway, we've heard that providers will deny services and/or file a lawsuit against the state, which at best will eat up more months before applicants get service. In other words, that might be a tactic. I don't know. Would anybody like to address those concerns submitted by one of our audience members?
Well, I'll jump in here. There's always been, in my decades of working with for and around the Missouri Medicaid program, and frankly, I've worked in many, many states. There's always some provider unhappiness with Medicaid, often with Medicare, with just government program, because the rates aren't always as high as I would like. I don't know that, what providers would sue the state. I mean, it's certainly not going to be all providers, maybe one of the associations, maybe one of the provider groups. But what's most important is to know that people will have their card or their eligibility coverage. And it's important to recognize that, we may have some areas of the state where we already have a provider shortage. And it's not just a provider shortage for Medicaid, it's a provider shortage. And then you add government funded insurance, and that may make it a little bit worse. So do I think this is an issue, again, to be concerned about? Absolutely. But I'm not, aware that there's going to be kind of across the board litigation and providers not taking Medicaid beneficiaries. Yeah, it really does point to the importance of the federally qualified health centers and the community mental health centers. They are such critical partners to all of us who are involved in the care and access for Medicaid beneficiaries.
Okay. Let's see. I'm taking something from the chat, and Nancy Price is pointing out that we need to be aware, and providers need to be aware, that some people who have neglected their health care because they didn't have money, they didn't have any insurance coverage, and so they've neglected preventive care. So when they finally, let's say they get enrolled in the expanded Medicaid program, and they do start accessing doctors and checkups and so forth, that it may be kind of costly. However, in the long run, the cost of providing coverage should go down, but initially it may be expensive for some people.
Yeah, that's true. But again, Nancy made a really good point. And right now you have folks that are using the emergency room as their primary care physician.
Oh, yeah.
And if these folks are going to the emergency room and they just so happen to be just uninsured, it's costing a lot more money than it is to just insure folks and encourage them to, as Nancy stated, start going to see the doctor more regularly than putting those things off. And, we always run into another really important issue. Every year we have to pass a provider tax in the state of Missouri, which would ultimately draw down federal matching funds for healthcare systems, hospitals, and us up in the sum of close to $4 billion. And that provider tax is a big deal for a lot of these healthcare systems because of that exact reason. Folks are going to the emergency room. Some folks are going in there uninsured, and that's putting a tremendous burden on those healthcare systems. And I'm not at all, because I'm going through the process of the FRA. I've understood the healthcare systems a little better than I did prior to doing what I do. They're still a business, but it does become a little bit less complicated with folks being insured and actually going to see their doctor than the emergency.
Okay, Amy?
Yeah, I would just add that, we, Medicaid expansion, that category of eligibility is covered through a managed care plan. So it's a per member per month rate that the state will be paying. And, much like private insurance. And so that's a capped amount now. Every month we will pay that same amount for coverage for somebody, and the managed care company provides that reimbursement to the doctors and nurses and so forth for that care. One thing that we have noticed is that the amount that we're looking at in terms of the per month cost per person is higher than other states, which gets to what Nancy, mentioned in the chat, right? That we have had people, our eligibility for Medicaid was so low for so long, and we've had people with very low incomes not have access to preventive care for such a long period of time that, we're going to be doing catch up. And the managed care companies recognize that, and so they've proposed a higher rate in Missouri. Hopefully that'll come down, but fortunately, again, it still ends up being a budget benefit for the state, no matter how you look at it, and it's definitely a budget benefit for individuals.
Okay. Donna?
I'll jump in here too. I know when we did other expansions earlier in my career, when I was at Medicaid director, when we did the CHIP expansion, when I've worked in other states, almost inevitably, you've got a lot of utilization. I mean, think about it. If you hadn't had an insurance card or any way to get your health care covered, and all of a sudden you have this card, I mean, you're going to go. And we should expect to see dental. We should expect to see people trying to get glasses so they can read. Basic things people have been needing. So it absolutely, I think it will be very expensive in that first year, or at least more expensive. But I know we've also seen in other states a drop off. And the managed care plans, all of the ones we have in Missouri, work in other states with expansion populations. So they've got experience, and they'll be working with the state of Missouri and their actuaries to set a good rate at the beginning and then a fair rate later on when we've got some experience and we can start to bring that rate down. But there's a lot of experience out there in other states where we can figure out and learn from them.
Great. Okay. Senator Williams, can you explain a little bit more about the provider tax that you were talking about? I'm not so sure I really understand it.
Yeah, it's, that's the scary part about it, because we have to deal with this, and it was a really big deal this year. This provider tax, essentially, what it does is so in the state of Missouri, we have what's called a FRA provider tax, and what that does is it requires to be a renewal. In the past, and correct me, Donna, if I'm wrong, in the past, they would do it every couple of years. Now it's becoming a little bit more political, where it's every year, to where it gives folks an opportunity to really kind of use it as a leverage tool for other priorities. So this year, we had a situation where for the past 20 years, we were past this provider tax, and it would allow healthcare systems to draw down matching federal funds. And a member of the legislature decided to add a couple members decided to add language that would essentially say if you were a healthcare provider and you were to provide any services in terms of women's health, birth control, or any type of contraceptive, they basically wanted to convince folks that it was abortifacient and that it had a connection to abortion, which ultimately would deny those healthcare providers of being able to draw down that federal match of funding. And we had to go into a special session this year just to try to work through that, because we did not want to pass a bill that would exclude healthcare providers like Planned Parenthood from being able to provide women birth control, because they would be concerned that they would lose funding. So we got it worked out. This is the first time that this has happened where someone has hijacked this provider tax in the 20 years of its inception. But that's essentially what it is. It's very important to healthcare providers. And it's something, I mean, again, that we pass every year depending on the bill.
Okay, thank you. Amy?
Yeah, so I just wanted to say, you know, one of the things that became clear this year was that folks in the Capitol who were messing with the provider tax don't really understand how critical it is to supporting our state's budget. And just to give some context, you know, that brings in $2 billion directly in revenue that supports Medicaid, but then leverages another 3.7 billion. So it's really almost $6 billion that we're talking about that was placed at risk with the debate this last year. And one of the things that we have started to help people, you know, talk about is that this isn't just about supporting Medicaid. It is critical. The provider tax is critical to supporting the entire budget in the state of Missouri, which means that it is critical for supporting education. It's critical for supporting healthcare. It's critical for mental health. It's critical for transportation, infrastructure, everything that the state does. And I think my internet connection might be unstable.
Okay.
Yeah, we got you. And I'm so used to talking about these issues among folks who are in the space or colleagues. So FRA is Federal Reimbursement Authorization Plan. So that's what that means. And I think if Amy said it, we would get probably $20 million in federal Medicaid funding by passing this tax. Wow. So those are dollars that our state would not receive if we did not pass this provider.
Okay. One last quick question. It was in the chat submitted by someone on Facebook. What about the homeless? Will lack of an address adversely affect them in terms of applying for Medicaid? And Nancy Kelly is responding that many homeless service providers are definitely looking at ways to help people they serve to successfully apply for Medicaid. Anybody else want to jump on that real quick, because we've got to start wrapping up? Donna?
You know, I'll just, and I want to thank Nancy Kelly from Missouri Foundation for Health. She's been helping us with information here.
Yeah.
So a lot of times, and Missouri has already done this. They will allow, because you have to have an address to apply, right? You have got to have an address to apply for any benefits. So you can use post offices, post office boxes. You can use the address of the homeless shelter. Sometimes you can use addresses of families and friends. There's a lot of different solutions. They're not perfect, but obviously someone who is housing insecure is struggling with a lot of issues. So I know that there are things in place to deal with it, but it's an excellent question. And I think it is certainly something we want to be cognizant of as well, is because these are the folks who have not been eligible. So many of them have not been eligible because they've been single adults, often males with mental illness, and they've just not qualified for Medicaid, and they are eligible now.
Wonderful. Okay, I can't believe where the time has gone. So we're now at the wrap up time. Boy, it doesn't feel like we've that much time has passed, but it's time to sort of wrap up. So we'd like to invite our panelists to make concluding remarks, whatever they want, and also to use this time to share information on the screen if they wish. I think they all know how to do, what is it, share screen on Zoom. Okay, so we'll start with Senator Brian Williams. He was last, now he can be first.
Yeah, I just want to thank the League of Women Voters, Delta Sigma Theta Sorority Incorporated, this esteemed panel, and Margaret Gray for just being just a huge part of this and making it happen. Most importantly, to the listeners, thank you for dedicating your time to engage in this conversation. You know, as a state senator, I'm proud to represent the state, not just folks who voted for me. And I believe that Medicaid expansion, access to quality health care, ensuring that we pass things like a provider tax, which would allow our healthcare systems to draw down federal funding, or just access to women's reproductive health rights, should not be partisan positions, and there should be common goals that we all share. So I hope that majority of my colleagues feel the same way this upcoming session, and if so, I'm confident we will be able to move our state forward together. So again, thanks for having me, and look forward to taking this fight further down the road.
All right, thank you. Okay, so Donna Checkett, would you like to go next?
I would, and I'm going to do a little screen share here. I hope, can you see my screen?
Almost. It says, there it is.
Okay, great. So this is the document that's also in chat. So I urge you to take a picture of this or go to the chat box and download this onto your computers, your iPads. But it is a terrific, very succinct explanation of what services are covered under Medicaid expansion, inpatient hospital, outpatient, prescriptions. It's huge. Prescriptions are covered. And then the next page, this is what Representative Applebaum was sharing, which is the income eligibility, and you can see it's family size, and then this is your monthly income, and then here is the website and the 800 number. And I urge you all to copy this and email it, email it to everybody in your contacts list. I mean, just for fun tonight. So no, seriously, but I think it's a great resource, and thank you so much for having me this evening. I really enjoyed it. Thank you.
Okay, you're welcome. All right, let's see. Amy Blewen. Okay, you want to unmute Amy? Okay, thank you.
Can you hear me now?
Yeah.
Yes.
So sorry. Thank you so much for having this. Again, I just I just want to echo everybody else in saying how important this is and how good it is that you all have done this. And the fight's not over. You know, in addition to helping people get enrolled, we need to make sure that stuff in the legislature is not creating barriers, right? So bills in the budget are not creating barriers. So I'm encouraging everybody, sign up for our email alerts. They're free. We track this stuff so that you don't have to, although I know that, you know, you all do that as well. So, you know, we're here if it's helpful, and look forward to working with y'all as we move forward.
Okay, thank you. And everybody get that email address, and Representative Ladonna Applebaum.
All right. Well, I just want to thank you for the invitation to be a part of this panel. I want to thank Margaret Gray for the invite, and to the League of Women Voters for organizing this and putting this on. I've actually learned a lot tonight. I'm really excited about this. And I also want to share that being on the Health and Mental Health Committee, the chairman of that committee is Representative Michael Stevens. And he has expressed to me that us working together to create more healthcare for healthcare workers, that's our goal for the upcoming session. So if anyone has any thoughts on that and wants to reach out to me, I would be thrilled. But again, thank you everyone for being a part of this, and thank you for everyone that's watching. And if there's something that I can do for you, please let me know.
Oh, okay, I'd like to thank everyone. And listen, any of our viewers who would like us to send some of the information that's been shared, please let us know. Sign up in the chat. Now, let's see, the League has developed a flyer, and let me see if I can find it. I don't have time to scare, but it's like this. It's very neat and handy. It's designed to be distributed in the general public wherever. So, and we're going to be giving this out when we do voter registration and whatnot. We're willing to share this with any organization, and you can use it to get the word out in the community. So if any of our viewers would like to get any of the information sent to you, I will send it to you. Just make sure that the League office has your email address, and we'll be happy to do that. Senator Williams?
Yeah, and we have a staff for a reason. I was just instructed that please go to our website and follow for updates, because we'll be providing updates not only around this issue, but throughout the entire session on what's happening, what bills to look out for, when to make call to actions. And then you can also go to my website and see pictures of my mom and grandma.
Okay, great. So Senator Williams has put his address, his what's that, your website address?
Yeah, it's
in the
just
chat.
senatorbrianwilliams.com.
Okay, that's super. Okay, so the League of Women Voters flyer, that link is in the chat. Click on that and you'll get this, and you're free to download it and duplicate it and send it out. Also, maybe we'll need to get together in the future, depending on what develops. Maybe we can, come up with a coalition of organizations for Medicaid expansion to help get the word out and get our fellow Missourians enrolled. There are so many people with so many health needs that have been neglected. That it just breaks my heart to even think about it. So that's something, if you would like to do something like that, if you or your organization would like to do something like that, the League is all for it. And so is Delta Sigma Theta sorority. We'd be all in with that, getting out in the community and just to get the word out. So I'd like to thank our distinguished panelists. Thank you so much for sharing the information. Thanks to all our viewers. Let us hear from you. And once again, if you want to contact, let's see. Okay. You can contact League at lwvstl.org. Thanks, everyone. And we'll also share that information with Delta Sigma Theta Sorority Incorporated. So does anyone else have anything? Wow, I can't believe it. I'm on time. It's just 8:29. Yay! Uh, thanks, everybody.
Thank you.
Anything else? If not, Sarah Baker, did you have anything you wanted to say?
Gonna say you can also get information. We'll post this information on our website, www.dstslmac.com. And also to those that are watching on Facebook Live, if you want to get this information, please leave your email address so we can get it to you, or contact us at info@dstslmac.com and we'll get it to you.
Okay, so we're just going to leave the chat information up there a little bit longer so everybody can get it. But contact us if there's something you didn't get a chance to write down and you want that info, we'll send it to you. Okay. Thanks, everybody.
Thank you so much for
Enjoy the
having
rest
us.
of your day.
Thank you.
Okay, we
Thanks.
appreciate it.
So
Bye.
Everyone take care, be
Bye.
safe.
Okay.